Hi everyone, and welcome to our very last video for the pediatric cardiovascular disorders series. Particularly today we will be discussing Kawasaki disease. Now, Kawasaki disease, this is a fairly simple concept once you begin to understand what it really is. There are not a lot of incredibly complicated processes like the trilogy of Fallot, nothing of that sort. So Kawasaki disease, all you have to know is its definition. Now, what is Kawasaki disease? It is acute. What does acute mean versus chronic? Chronic means it happens through time, it is gradual, etc. Acute means it happens all of a sudden, in a snap. Alright? So acute, kung sa Bisaya, kalit. And in Tagalog, it means biglaan. Alright? So acute, systemic, vasculitis. That is all you have to memorize when you think of Kawasaki disease. It is acute, it happens suddenly. Systemic, what does it mean? Meaning the symptoms exist throughout the body. It manifests in different parts of the body. That's what systemic means, right? It's not just in one part, it's not just in the heart, it is in all parts of the body. Vasculitis, let's break that down, okay? Vascu, what does that mean? Okay, blood vessel, right? And whenever you hear the word itis, inflammation. Inflammation. Again, what you have to remember in Kawasaki disease, acute systemic vasculitis. So vasculitis is the inflammation of the blood vessel. The blood vessel where? Is it just in the heart or is it in the whole body? Again, systemic. So in the whole body. Manifestations are in the whole body. Does it happen chronically or all of a sudden? All of a sudden, acute. So again, the inflammation of the blood vessels throughout the whole body, and it happens suddenly. Kawasaki disease. Now, again, it is the inflammation of the blood vessel. Do we understand so far? So by just knowing and just memorizing that definition, you will understand the signs and symptoms. Again, what does letter S stand for? Acute systemic. Systemic vasculitis. Okay? So our keyword, it is inflammation. Now, what comes to mind when something is inflamed? It is red, right? It is hot, it is red, it is there's heat, right? So I want you to picture that in your mind. So do you think the patient will have a low fever or a high fever when all of the blood vessels in your body is inflamed? Of course, high fever. Remember that, okay? In Kawasaki disease, the fever is high spiking because all of the blood vessels in your body is inflamed. Next, if you look at your eyes, there are blood vessels in your eyes. What happens, you think, when the blood vessels in your eyes are inflamed? Photophobia. You're sensitive to light, right? Because again, it's already inflamed, and when there's increased stimulation like bright light, of course, that will mess with your vision, with your senses, and with your perception. So there's also photophobia. All right, again, that boils down to inflammation of the blood vessels where? In your eyes, because again, the manifestations are in the blood vessels of the whole body. Now let's look at the patient's eyes again. But the lining of the eyes, the mucosa. Okay? Conjunctivitis. Look at this. There is inflammation here again around your eyes. Right? So of course it will look red, sensitive. Okay? Conjunctivitis. Inflammation of your conjunctiva. Again, it boils down to the inflammation of the blood vessels in your conjunctiva. just the inflammation of blood vessels. Again, systemic. Next, let's take a look at the patient's tongue. It looks scary, no? But what happens to the blood vessels in your tongue when something is inflamed? Okay, when everything, all the blood vessels in your tongue are inflamed, will it look blue or will it look red? Of course, red. Strawberry red tongue. And put a star beside that because that is the pathognomonic. Whenever you hear strawberry red tongue, no, that's Kawasaki disease. Alright? In the skin of the patient, what do you think will happen if the blood vessels lining your skin are inflamed? Will you have rashes, do you think? Will it be red? Will it be blue? Cyanosis? What do you think? Of course, it's red, mga rashes. And it's called a polymorphous rash. Okay? In different shapes and sizes. So that's what the polymorphous rash looks like. I just got these photos out of Google, by the way. And in your hands also. How come there's palmar desquamation? Because there are also vessels here in the thinnest membranes of your skin. So you'll also have palmar desquamation. So just remember those signs and symptoms, but more importantly, understand that Kawasaki disease is just the inflammation of your blood vessels throughout your body. So you can picture it already, what happens and why they happen. The photophobia, you know why it happens. The high fever, of course, because the blood vessels are all inflamed. Conjunctivitis. Again, inflammation of the blood vessels in your conjunctiva. Strawberry red tongue, polymorphous rash, and palmar desquamation. Now, diagnostics. ESR. Okay. Erythrocyte sedimentation rate. I want you to recall what part of our previous lectures was ESR involved. That is your rheumatic fever. It's part of your Jones criteria, right? So revisit that if you forgot it, but it's part of your Jones criteria. Now again, what is ESR? The erythrocyte sedimentation rate. That is an inflammatory marker. Meaning that when your ESR is high, that is an indicator that some part of your body is inflamed. So in Kawasaki disease, do you think the ESR is low or high? Of course, it is increased. You understand? Now let's move on to management of Kawasaki disease. I want you to think of a very common medication that we give to patients that has anti-inflammatory effects. It might even be in the name of the drug. Alright? So it is your NSAIDs, non-steroidal anti-inflammatory drugs. And what is the most common? Of course, it is your acetyl salicylic acid, otherwise known as your aspirin. Like I mentioned again in the previous videos, aspirin has 4 functions, 4 A's of aspirin. Okay, 3, 4. 1, it's anti-pyretic. Number 2, it is anti-inflammatory. Number 3, it is an analgesic. Number 4, it is an antiplatelet. Now, what properties of aspirin do you think are useful in treating Kawasaki disease? Of course, it's this: anti-inflammatory, non-steroidal, anti-inflammatory drugs. Also, antipyretic. How come? Because we have high spiking fever in Kawasaki disease. All right. Number 2, we also have immunoglobulins. So by the way, I got these from Saunders. So Just remember the two management for Kawasaki disease, your aspirin and your immunoglobulins. So the pathophysiology as to why immunoglobulins treat Kawasaki disease is not fully understood, but according to Saunders, it helps with reducing the fever and the risk of aneurysms. All right, so let's move on to a short quiz. Kawasaki disease is again what? The three words I mentioned: acute, systemic, vasculitis. Fever, high spiking fever. What's the rash? Polymorphous. What's the polymorphous rash? Pathognomonic sign, it is your strawberry red tongue. Okay, palmar desquamation. Your management: aspirin or acetylsalicylic acid and immunoglobulins. And that again, my friends, are your board bites. Just remember that. Understand this. It'll help you remember everything else. Let's take a look at our question. You are assigned to the pediatric unit and a child is admitted for signs and symptoms indicative of Kawasaki disease. What we remember by Kawasaki disease is the acute, systemic, vasculitis. What are the signs and symptoms? You will have high fever. Number 2, you will also have a polymorphous rash, a strawberry red tongue, and palmar desquamation. High ESR. And then the management is your aspirin and immunoglobulins. Now, let's take a look. We're looking for what symptoms do we expect to observe. So we're looking for what is positive in Kawasaki disease. Machinery-like murmur. What is that? It's not here. It's not in any one of these board bites. This is actually PDA. Remember? And that is wrong. Cold, clammy skin. Do you think a patient who has acute systemic vasculitis and high fever will have cold, clammy skin? No. Wrong. Subcutaneous nodules. What is that? Subcutaneous nodules. Where can you find that? In Jones criteria in RHF. So again, I recommend that you take a look at the other videos that we have as well. Okay, so it leaves us with this: inflammation of the mucosa. Inflammation, check. Okay, inflammation. Strawberry tongue, pathognomonic sign. Conjunctivitis, check. Remember the baby with the red eyes, right? So this is very positive for Kawasaki disease, and our answer is letter D. Also, the notes, flashcards, summaries, quizzes, and many more are listed in the description box down below. Don't forget to join our community where we share more topics like these. Thank you and goodbye, future RNs.